anything else, before anything else, Healthcare Without Harm, Southeast Asia is part of an international nonprofit organization working with hospitals, health ministries, and even climate justice advocates, working towards greener healthcare operations and climate justice. So we have some of our banner programs that's mentioned here. Climate and health program. We have a membership platform, a membership network that we call Global Green and Healthy Hospitals. That is following or fulfilling the 10 sustainability goals. We have our plastics in healthcare program where we work with hospitals and health facilities, reduce their plastics and especially single-use plastics usage in the hospital. We have RISE Southeast Asia, which is an alliance of health professionals and climate and environmental advocate leaders in the region, and sustainable procurement in healthcare. So all of these programs, all of these initiatives are basically boils down to our work in healthcare sector in heeding its call, in heeding its Hippocratic oath of doing no harm. So my presentation for today is transforming data into stories. Um, so with my years of working in Healthcare Without Harm, we have been working not just with the hospital administration, but even the nurses, doctors, and those working in the communities, the caregivers, the midwives. Um, and we help them transform their stories from the communities, the data, the key informant interviews that we gather from the visits into advocacy materials. Um, so before anything else, we'd like to say Howard Fromkin, numbers numb, but stories stick. So we always tell our the people that we work with, the health professionals that we work with, that data is very important, but transforming it into stories that are relatable is more valuable and inspiring. Um, so in any organization, in any institution, may it be health facility or it's an organization, uh, stories are important, or they depend on stories to move projects forward. It's basically the base of where we base our action plans, where we base our next steps. So that's why even in increasing funding opportunities for an organization, stories are basically used. Um, and so it makes storytelling a very important tool for communicating the facts and experiences that shape an organization. So in Healthcare Without Harm, we always say that every healthcare organization has storytellers. Our nurses, our doctors, they work every day in the health facility. They encounter so many patients, and they even work with the community. So there are a lot of stories that they can tell, right? Um, Sorry, someone is calling. I'm sorry. Uh, so this is where we tell or we share on what we are doing, what we have been doing with Healthcare Without Harm, how we are working with the healthcare sector, how we are working with the health professionals in supporting them, providing resources, providing support on how they can transform their data into stories that we can use to inspire climate action. So first, very recently, it was last year when we came up with a climate impact checkup tool. So the climate impact checkup tool is basically a GHG or carbon emissions calculator that the healthcare sector can use. So it can estimate and classify one's health emissions to aid in developing appropriate mitigation plans. So what can the climate impact checkup tool measure? So there are three scopes. So as you can see in the presentation, so the impact checkup tool can uh, calculate your stationary combustion, your mobile combustion, your fugitive emissions like cooling, anesthetic gases, and even the waste on site treatment. So when we say scope one, it's basically the direct emissions, what the hospital or the health facility is using. Um, Scope two is purchase electricity. So you can also measure the greenhouse gas emission equivalent of your purchase electricity. And last but not the least, scope three. So scope three are the indirect emissions that the healthcare sector is utilizing. So it can be, business travel when a doctor needs to be in a seminar abroad. It's also electricity transmission, inhalers, waste that is being treated off-site or being disposed off-site. It could also be, employee commuting and patient commuting. So it's not you cannot control basically scope 3, so that's why it's indirect emissions. So we process this data, uh, or the tool can process this data when a health facility inputs their energy consumption for the year. The tool is going to calculate and give you an equivalent of how much that is in carbon emissions. So through that, through the data that you have gathered and calculated through the tool, you have your narrative, you have your data, and then eventually your visuals. It can be a graph, it can be a table where you see the difference, of how much carbon emissions you have been producing for the year. So all of that, you know you use all of those materials that you have based on your data and the stories from the ground uh, to develop an action plan. So here in this slide, we want to say that good data leads to informed personal decisions and improve public policy. But we need to remember that good data is only good data if it is accessible and easily digestible, right? So a relatable and understandable public health data is no longer an option. It is a mandate. Uh, so these are examples of how the users of the impact checkup tool can use their data. So they can present their decarbonization solutions, and at the same time, they can inspire other health facilities to use the data in order to drive climate action. So some examples are, for example, here the first one, meatless campaigns in the hospital. So when you already calculated using the checkup tool, like how much food waste you have been producing, um, then eventually you're going to uh, employ food waste um, initiatives, and then eventually start a campaign for meatless days in the hospital. You can also do a campaign on bringing your own water bottle if your data has produced that the hospital is wasting or producing more single-use bottles. And then that's the time that, okay, so we're going to reduce. No, um, you can also start a social media campaign for healthy hospitals for all. You can also use your data to develop a white paper based on your data and interventions, case studies, case studies, best practices. And then last but not the least, you can also use your data to produce a press release or a website article, or anything that tells about your decarbonization journey using the tool. Um, and of course, no, last but not the least, we conduct interviews. We work with health facilities. We work with health ministries in drafting their action plans for climate mitigation, for climate action. But basically, the heart of what Healthcare Without Harm is doing is using the voice of healthcare to transform uh, healthcare operations and drive climate action. um, we have realized in the past few years, especially during the COP26 last year, uh, where health was already mentioned. It was already in the front line of climate discussions. No? So everybody is realizing that climate change, is not just an environmental issue, but a public health one. So why healthcare voice, right? Why use the voice of our doctors, of our nurses, of caregivers, etc., health ministers? Um, because because our health professionals are one of the most trusted voices in the society, right? We have been patients. We have we have friends who are doctors, who are nurses, and we always talk to them because we trust their opinion. When we ask something, or an advice that's related to our health and well-being, we always go to them, right? So basically, they are an influential force in society. So that's why we keep on telling our networks, our allies, that the healthcare voice is very important if we want to drive climate action and influence policies. So as an example, healthcare without harm, by using the healthcare voice, have launched a lot of campaigns, a lot of initiatives where the healthcare sector is at the front line. Um, so we see here, this was in 2019. We gathered hospitals, health institutions, health ministries in a Green Hospitals Asian conference where we talked about different initiatives that our healthcare or our hospital allies and networks have been doing uh, to drive, to make sustainable, climate resilient, and green healthcare possible. You know, we have worked with health professionals in the Philippines, call for healthcare climate action now. We have been conducting workshops, providing resources to different health facilities, not just the big hospitals, but even those based in the communities, on how, whether it's small or big initiatives, how they are going to, do away with fossil fuels, choose healthier energy resources, how they are going to reduce their waste, especially single-use plastics in their healthcare operations, what is sustainable procurement in healthcare, etc., etc. Um, and we have produced this global roadmap for healthcare decarbonization. We produced this last year, where basically the aim is to help the healthcare sector navigate in decarbonizing, in lowering their carbon emissions. As what I have mentioned earlier, with the climate impact checkup tool, we need to have a baseline and then an action plan based on the results of that baseline. So if you are seeing that your carbon emissions from energy consumption is, very, very, very high, then it's time to employ something, to conduct an initiative that will lower your carbon emission, your carbon footprint. Also, last year we produced this toolkit. It's a communications and advocacy toolkit, um, specifically for health professionals and climate advocates in Southeast Asia, on how they are going to talk about climate and health, in anything that they do. How are they going to communicate the climate impacts on health and well-being to their patients? How they are going to um, influence policies? How are they going to develop messages that will inform decision making, that will inform policy making? How are they going to inspire other hospitals, other healthcare professionals in joining, the movement towards a greener, more equitable and climate resilient future? So if you want to check it out, here's the bit.ly link. Also, a very important example of how we have used the healthcare voice um, in towards, influencing change, is this healthy climate prescription letter. So this was drafted before COP26, and the aim um, call for climate action, no, among the healthcare community, among the health community, and the COP26 delegation presidency. No, and it was signed by 600 healthcare organizations representing 46 million healthcare workers all over the world. And here in Southeast Asia, the RISE Alliance have signed. Some of our members with the Global Green and Healthy Hospitals have signed, and it's good news that the healthy climate prescription will also be talked about, will also be discussed um, in the upcoming COP27. So the use of the checkup tool data is basically one, to inform decisions, to influence policies, to transform operations, and to raise awareness and inspire others, and safeguard communities. We keep telling our, the people, the institutions that we work with, that without a healthy planet, there's no healthy people. Our health and well-being, the health and well-being of our environments, of our communities, are linked, no, in the situation, in the condition of our environment, of our planet. So a reminder again that in terms of health and education, it's very important that we get your data. No, we have a baseline of our carbon footprint in order to uh, initiate change. So again, thank you very much, and I'm Pats.
Thank you, Pat. That was a very interesting presentation. I just want to share a few thoughts from our participants in the chat box. We have Mai, who said, "This is very interesting. Laos, the healthcare sector doesn't really care about the environment," and the same sentiments is shared with Lala, who said, "Hospitals in Indonesia are highly dependent on national credentials. I hope there's an advocacy on including green hospital concept into the credential assessments." Just touching on that, when it comes to sustainability and climate change, hospitals and the healthcare system in general is not the priority focus to begin with. It's usually like you have our usual like culprit industries, like you go through that, and then maybe like healthcare comes through. So how is the onboarding process, how does this happen for hospitals to, how do you inspire hospitals to drive this climate change action?
Yes, thank you, Samira. So what I have mentioned earlier is the Global Green and Healthy Hospitals Network. So it is basically our expansion network, and we already have in Southeast Asia alone, we already have 100 plus members. So we usually attack the issue or present the issue in a way that being sustainable and climate resilient is not just helping them become more greener, but also it's going to provide them more savings that they can align or realign, to other initiatives within the health institution. So really, it's because we know that hospitals is interested in profit and what they can save. So that's where we start the conversation.
Thank you for your answer. And just to add on to that, what is the top priority in terms of healthcare actions when it comes to raising climate change related issues we should address in the ASEAN region?
The main issue that they are interested in.
Yeah, the top priorities in terms of healthcare actions when it comes to raising the climate change related issues.
Right. So first, of course, it's really the transition to healthier energy resources and energy options. But it's like, for example, in most health facilities in our region, um, it's a bit tricky because it will require a big budget, to put up a solar rooftop, for example. So for now, um, like here in the Philippines, those that are capable are just private hospitals. The public hospitals are still hesitant. Um, so first is renewable energy options. Second is waste reduction, and then sustainable procurement.
Mhm.
Mm.
Yeah, in terms of waste reduction, I feel like the healthcare sector does produce like a lot of waste, even with, for example, we've seen through this pandemic, like how much waste we have been able to accumulate, like globally. Has this sort of pushed the adoption of turning hospitals into like greener healthcare?
Yes, I'm very happy to say that most of the hospitals that we work with have done, a lot of um, ways on how they are going to reduce and eventually eliminate single-use plastics. So one example, um, one in the Philippines, a hospital during the COVID-19 pandemic actually, because we have seen the rise in single-use plastics, right, with the PPE, etc., etc. So what they have done. The they made their own reusable PPEs using washable materials. So they made a lot of that and they gave that to all their staff. So they at the end of the day they don't have as much as PPE waste like other hospitals. Another example, the Suchi Hospital in Penang, Malaysia. They have started their or they have a garden, vegetable garden, and their harvest they provide for their patients and their staff. So that's reducing food waste, and even procurement and transportation of the food, right? So you're already cutting your carbon emissions. Um, Another example, another hospital here in the Philippines, they've thrown their plastic water bottles and they've installed water refillers in the hallways of the hospital to encourage, refilling instead of buying bottles in the canteen, um, and a lot more.
That's very interesting because it's simple solutions that create the biggest change. Like the most PPE, the doctors, you just wear it and throw it out, but turning it washable, that you've eliminated so much was such a simple process. I just want to move to a few participant questions. So starting with, let's see, with Fontip. Fontip, would you mind like unmuting and asking your questions directly to Pats?
Okay, can you hear me?
Yes, you
Yes, you
can.
can. Okay, so thank you so much, Pat, for sharing. And I see your slide show how important of the data. So I wonder that how could you collect all of the data that you want, and how could you know that the data is accurate and coverage enough? Because I think sometimes it's quite challenging, like to identify and access all of the stakeholder, and sometimes they may have like some difficulty to sharing data, especially the kind of sensitive data, something like that.
Yes, thank you. And I agree. So one, how are we collecting the data? So the climate impact checkup tool, it is housed in a platform, no, that we call Connect, GJHH, Global Green and Healthy Hospitals Connect. So it's like Facebook. So it's like Facebook, but uh, with a data input technology. So the hospitals or the health facilities, they have their own accounts in that platform. And then I hope that I can show you probably in a different discussion the platform. But so it's really just an input and it's available also offline. So that is how they are inputting data. And then at the end of inputting the data, after you've completed your inputs, energy consumption, waste production, et cetera, the last slide or the last step in completing your data input is it's going to produce, like automatically, the platform is going to produce a graph. So that's how they are seeing, what a baseline. That's how they're going to get their baseline. Um, and in terms of data privacy, they only have the password to their own account. Even us, like, we cannot see their data, but we are always available in case they have questions in terms of technical assistance, etc., etc. Um, and we conduct regular workshops with our members to help them use the tool better. Also, we provide guidance on where they are going to get their data. Like how, for example, who do you go to or who do you call if you need your energy consumption bill? Or who do you talk to if you need your waste data? Um, so it's also, we also reiterate that to them, because most of the people that attend the workshops on the tool are high level or the admin, and we always need to ask them, like, do you know who you're going to talk to if you need your energy data for the month? So I hope I answered your question. Thank you.
Thank you so much.
Thank you, Fonte, for asking that question. Moving on to Diana. Uh, so, Diana mentioned that it's interesting to know that healthcare and climate change is strongly linked. Now, if only people are more focused on their health through protecting the environment instead of depending on pills and medical care after all the damage that has been done. So, Diana had a question for you. Diana, do you want to unmute yourself so you can ask your question directly?
Hi, can you hear me?
Yes, Diana.
I left a question at the bottom, but I'll ask that. How do you approach like hospitals, like especially private ones, to get them into the green initiative, especially when they have like uh, a lot of board of directors and they may or may not be interested in what you have to say?
Thank you, Diana. So actually, based on what we have experienced, most of the private hospitals in the region are one, they are very interested in recognition. They are very interested in awards, seeing their name, seeing a badge of being green and sustainable. So that's the first strategy. So we actually provide, like, even with a simple, recognition that, oh, this hospital has joined the Global Green and Healthy Hospitals Network, for example, or this hospital has inputted their 1 year data in the checkup tool. So small steps, we provide them recognition. Um, and second is, as I've mentioned earlier, we always use the savings and the profit messaging, because they always would like to know, like, how are we going to earn, are we going to save, aside from being green and sustainable. So thank you, Diana.
Thank you, Diana. Just going back to the data-driven solutions, when it comes to determining the healthcare impact and the well-being of marginalized communities, how has the impact been for marginalized communities?
Yes. We Healthcare without harm, most or some of our hospitals are not exactly nearby, but at least there's one hospital here in the Philippines that, from the rooftop, you can actually see the coal plant. um, but there are also health facilities that we have worked with, that directly work in the communities. So we have seen, like, one community that we have visited before the pandemic. It was exactly beside a coal plant. So the only thing that's, dividing them is basically a wall. And we conducted a health assessment. We brought some of our health professionals, doctors that we work with. We brought them to the communities, to initiate a knowledge exchange workshop, and at the same time a public consultation with the community. And there are a lot of health impacts. One, the number one health problem within the community for the past 10 years is a respiratory problem. And during at night, one of our staff stayed overnight in that community. And, at night, that's where basically the coal plant is operating. And you can actually see um, the air pollution, the that's coming out of the coal plant. So it's respiratory problem, and there are skin diseases, and the local government is actually, like, playing down the issue that it's saying that, oh, the skin disease are basically just because, you're playing with dogs, or there are a lot of stray dogs in the community. But of course, our doctors, because they are doctors, they also gave their own opinion on those health impacts. We also They also brought us the coal ash, because the coal plant is producing ash, right? um, and it's not disposed of properly. So it's basically just dumped also beside the community. So it's when a strong wind comes, the ash is like flying. Community is inhaling the ash. um,
Thank you so much, Pat, for your entire presentation and taking questions from the participants. Uh, what I'm getting from this is like we really need to reevaluate how we approach sustainabilities when it comes to like healthcare and try to like move towards a much like greener industry throughout all the industries in the economy. And yeah, I just want to make a quick announcement. Like, if you would like to stay back and hang out with our participants in Gather Town and probably have a chat, you could do so at the end of this session. So thank you so much, Pat.
Thank you, Samira. Thank you, everybody.
Right. Okay, moving on to our second presentation. Today is by Ruma Energy, which is an Indonesian NGO supporting grassroots communities in poverty alleviation, climate change mitigation and adaptation efforts, and disaster risk reduction. Their goal is providing beneficiaries, namely farmers, women, and vulnerable communities, to have better quality of life and be resilient to the impacts of climate change. With us from Ruma Energy is Jihan, who has been working in domestic biogas sector for over 3 years and has recently been involved with helping Ruma Energy achieve one of three goals, which is approval of from Indonesia NDA for GCF proposal as second lead writer, funding from the WE4F for its commercial wing development as a co-writer in ESG aspects, and lastly, the polyethylene based digester standardization manuscript as a concept writer. Thank you so much, Jihan. You've been doing amazing work, and the floor is yours.
Okay. Thank you, everyone. Can you hear my voice clearly?
Yes, I can hear you.
Okay. I will share my screen for a moment. First of all, I would like to thank you for everyone to provide these opportunities to share our work in Rumah Energi, in which this our model is to give people power. Um, so Rumah Energi is basically a non-profit organization in which we established in 2012. Please wait. I think I got some issues uh, in this slideshow. Just wait for a moment. Excuse me. Okay. So our mission is we have four missions actually in poverty affiliation and then disaster risk reduction. And our main mission is actually in climate adaptation and mitigation, and as well as capacity building for the community in urban communities. And so for this mission, we have three programs, mainly in renewable energy, and the derivation is in food security and social entrepreneurship. So currently, we have three main projects that undergoing in Rumah Energi. Our largest program is BIRU, or Indonesia Domestic Biogas Program, in which I serve as the technical officer in this program. We already have more than 124,000 beneficiaries, and for every biogas that we have built, it could prevent emission of 2.5 tons of CO2 per year per unit. And the other project is a SCORE project, in which our main goal in this project is to leverage the livelihood of farmers. So we provide business incubation to farmers, how to create a good product in compost, and it also intersect with the biogas as well. So we train them how to mix the cow dung with the organic matters as well as bioslurry from the biogas. And then our third project is the Hati Kalimalang project, or the heart of Kalimalang. It is basically an advocation project for river conservation in which I serve as the team leader of this project. So we try to advocate to every stakeholders, including the regulators, the operators, and all communities around Kalimalang. It is one of the main river to main channel actually to provide fresh water for Jakarta. So, and other works that we have finished in the previous work is one inspirative program. So we basically provide training for women in uh, financial system, and then also the gender action learning system. And also the green cooperative program, it is actually we cooperate between every cooperatives in Indonesia, mostly in East Java, how they can get access to economic uh, economic financial sorry they can get access from many financial providers to support their green business system. So in Indonesia, we actually have already uh, doing in 17 provinces with total national biodigester built around 26,000, nearly 27,000, with more than 100,000 people as our beneficiaries. And we have create in doing this program, we actually in cooperation with small business units across Indonesia, and we have already more than 60 business units, and we have partnership with cooperatives, with other small businesses and credit unions to provide economic access to our users. And we also provide trainings to every masons across Indonesia with nearly 1,500 masons. And we train farmers to do the best agricultural practice based on bioslurry to more than 27,000 people. So the Bureau program as our main project is actually initiated by the Netherlands Embassy. It was started in 2009. It mainly started in three provinces in Java, and then in 2012, Rumah Energi is established, and so uh, and now Rumah Energi is the sole organization that handle this project. So in 2021, we reached the 1 decade program of this program, and we are currently establishing partnerships with other similar program in Africa, like in Uganda and Kenya. We have establishing partnership in the carbon trade system. I think for those of you which comes from Cambodia or Vietnam already heard this kind of program, because we have similar program as uh, this program is actually in the early years initiated by Netherlands with support from SNV as the technical advisor, and he was a foundation from the Netherlands. So in our ecosystem, Rumah Energi is actually doing several parallel movement. Like we are doing advocacy and policy advocacy to the central government as well as to the local governments, and we partnership with microfinance institution to provide loans for the so that the cooperatives can provide loans to our biogas users. And then we also have partnership with the we so-called as construction partner organizations, which mainly comes from small enterprises. So we provide training how to construct the standardized biogas biodigester, and then they will do all the construction and commissioning of the biodigester. After the construction is finished, and then we will uh, provide trainings to the users of the biogas on how to operate the biogas, as well as how to maintain the biogas and how to utilize the bioslurry for their agriculture practices. So because the topic of our today's discussion is on health. This program is actually have an annual user survey in which we try to evaluate the impact that we have give to we obtain from this program to the farmers and the communities. And in terms of health, we actually get some proof that our biogas can actually reduce the eye redness and the eye infection and cough, because it is still common in rural areas of Indonesia, like in Sumatra, in Sulawesi, and Nusa Tenggara, where people use firewood for their cook stove, and by using the biogas, they can actually prevent the particulate matters to goes into their respiratory system. In terms of economical benefit, there are around 50,000 rupiah of the saving they can have from owning a biogas digester. So the carbon scheme from Rumah Energi, for every biodigester that we have built, we are doing annual user survey, in which called by the biogas user survey on the left. So it is done by a third party of our research consultant, in which then the monitoring report is given to the verification bodies, and then the verification bodies will deliver it to the gold standard. So our carbon scheme is actually under the gold standard program. And then from this approval, we provided access to the buyers, and then for every tons of CO2 that have been sold is returned to our construction partner organizations and farmers. So we provide the carbon that's sold in the carbon market and in form of subsidy to every biogas construction. So let's say if you have 10 million rupiah as the construction cost, you will need only 7 million, because the 3 million is subsidized from the carbon then that we have obtained from the carbon market. So the technology that we adopted in this program is the concrete fixed dome digester, or the digester 1.0. And because we consider that this construction is getting higher in prices, but year by year, we try to uh, create several innovations. We try to improvise, like we are using polyethylene water tank as biodigester 2.0, and as well as the fabricated using fiberglass in the biodigester 3.0. So I think the technology is quite mature enough in every country. But in Rumah Energi, we also provide a medium scale, in which more than 20 cubic meters of biodigester. And we are currently deploying several biogas sensors to monitor the consumption of biogas and the carbon footprint more precisely. And in this program, we have partners. We had partnership with National Standardization Agency. We already have the standard for the concrete fixed dome biodigester one, and we are currently developing the standard for the polyethylene digester. And we expect that the standard for the polyethylene is going to release in this year. So, including the sensors, this is like the capture of how we can analyze how the consumption of the biogas. We can maintain, monitors the energy usage and in what time the customer is often uses their biogas, how much uh, gas consumption in order to we can have we can we can monitor the consumption. And our development currently, we are develop our business in bioslurry. So we establish PT uh, Pupuk Suburkan Negeri, in which we already granted several, uh, I think around 200,000 US dollar from V4F. So this company just started by this month, and we are going to develop this business in East Java. So using the sensors, the available sensors, we will utilize mobile app to precisely collecting the bioslurry produced by our biogas users. So the bioslurry is basically comes from the existing users. Okay, so in relation to the SDGs, already contribute to several SDGs, like in SDGs number one, number two, three, good and well-being, as I mentioned earlier, in gender equality, as well as the mainly in affordable and clean energy, and also for the climate action. Uh, so, what we could do is to give people power to summarize all that we have done is the advocacy in policy to the governments, analytics of the data, product development to minimize the cost of the construction, as well as to develop the businesses of our partners. And we provide capacity development and technical assistance to all our partners, and program design and implementation. So this is so far all of our partners and donors, international and national partners. Okay, thank you very much. I think that is a brief introduction from Rumah Energy. Thank you.
Thank you, thank you so much, Johan, for your presentation. Just to touch back on how Ruma Energy measures the metrics, what are the metrics that Ruma Energy uses to track when it comes to determining the impact for your end users in terms of the biotechnology, the G emission reduction, and health improvement?
Uh-huh. So our main metrics is actually from the now the quantity of saving that our every our beneficiaries is obtained, and mostly other than the economical savings, we also measures the number of beneficiaries along the projects, and also the emission reduction of for the whole projects. I think that is that three is our main metrics for measuring the impact that we have given through the Biru program.
Thank you. In terms of the best agriculture practices, how important is it for Southeast Asian countries to rethink their agricultural practices as we move towards a more greener, more sustainable environment?
Yeah, it is. Actually, we have quite a lot of potential in Southeast Asia, I think, because like in Indonesia itself, we have a lot of cattle as our source of organic fertilizer, and it is actually it's still how do I say it? It's still uh, it's still overlooked by everyone. In our experience, by using the biodigesters, every farmer that uses bioslurry from their cattle that which already undergoes the anaerobic process in the digester, they can actually obtain like a 10 to 30% increase of their annual yield in their farmland and croplands, because the bioslurry is uh, rehabilitating the soil, and they provide better nutrients for the crops, and it is actually one of the most important parts in agriculture in Southeast Asia, because Indonesia, I think, it has quite similar characteristics with other uh, countries in ASEAN, like the Vietnam has already the national biodigester program. The Cambodia also already have the biogas program. I think this potential is good for us, and we should actually spread this program larger to other countries in Southeast Asia as well.
Thank you. In recent years, like raising cattle has become like a little bit of a controversy in the environmental community. So I just want to go back and ask, could you explain what bioslurry is and a little bit more on the benefits?
Okay. I'm sorry that I haven't explained that term yet in the beginning of my presentation. Um, so bioslurry is simply the products, the side products of uh, processing the manure, the cattle dung, after they going through fermentation process in the biogas digester. So you have the main product, the biogas, in which you can use it for cooking, and then you have the second products, the bios that in which we call it the bioslurry. It's a slurry, but it is rich in nutrient because the methane is already extracted from the cattle dung. So we can basically say that the bioslurry can be directly used to crop plants as a fertilizer, as organic fertilizer, without harming the crops itself. Because if you compare it to the fresh dung, if you apply it directly to the plants will directly die because too much methane content in the dung itself. And after the dung goes through a fermentation process, you have extracted all the methane, and that will create a better fertilizer because there are many bacteria inside the digester that create other provide other nutrients in the bioslurry. So it is we already tested our a lot of our bioslurry from several sources, and it is proven that a bioslurry in terms of nutrient content is much better than regular composting system from the cow dung. So in summary, we can say that bioslurry is actually just a natural fertilizer comes from cow dung and mixture with water. I hope
Thank
that
you
can
for
explain to you.
Yeah, thank you for explaining that for us. I think it's a brilliant way to rethink uh, fertilizers and what we put back into the ground. I just want to pause on my questions and move to the participants. We have a question from Al Heru from Indonesia. Al Heru, would you mind unmuting yourself and asking your question directly to Jihan? Oh, it's okay. He's on the train, so let me ask the question on his behalf. Would it be possible for Ruma Energy to supervise people who want to start a similar project from the beginning?
Yeah, our supervision scheme is actually for every location that we uh, in which let's say it's a new location that haven't had any similar projects before. We started by examining the potential in that location, and then we identify which small businesses that we can cooperate with. Usually we try to identify two small businesses. The first is the technical businesses like construction business and etc. And the second is the financial businesses to provide the financial access. So after we identify and we socialize, we provide uh, a review of the program. We would we would start by providing technical trainings for the small businesses to do how to do the construction properly, because we have standardized biodigester, and because we also uh, we aim to prevent carbon dioxide emission from every biogas, in which we monitor annually. We try to make sure everyone should construct their biogas according to our standards. So after we provide them the technical trainings, usually we have a three quality inspection supervision. So the first is after the construction, we have our field technician to check whether the construction is according to our standards. And after the construction is found to be according to our standards, they will obtain the subsidy that I have mentioned earlier. So the subsidy is not in the front of the construction, but it is after the construction is done. We check whether the construction is according to our standards or not, and then if it is according to our standards, we will give the subsidy. And 1 year after the construction, we also do another monitoring. It's like our guarantee, our warranty services in the first and the second year. So we try to we always make sure that the biodigester is functioned properly. So it is very possible for everyone to have similar projects, whether it is in Indonesia or outside Indonesia, I think.
It sounds like a very adaptable like model for people
Yeah.
to take from like different places. As you also mentioned before, you have like projects in uh, Africa and Uganda and Kenya. Just looking into more into like the business side, taking a step back, can you share a bit more about what motivated Ruma Energy to start the organization, and how did the organization grow so big in terms of their outreach in the past 10 years?
Okay. Yeah, the main driver of the establishment of Rumah Energi is actually the Indonesia Domestic Biogas Program itself. So, because at the time the government have the regulation in where this program should be conducted and implemented by local organizations. He was with the Ministry of Energy and Mineral Resources, established Rumah Energi as the local implementer of this program. And then we actually very we are helped by HIVOS in almost every part uh, of the development of Rumah Energi in the early years. Uh, from the technical assistance, from the business development assistance, and almost every partners, and we even like almost regard he was as of our parents, and but after 2020 or 2019, if I'm not mistaken, uh, the partnership with our main donors has been cut off. So we are currently moved by our own. So in order to survive, we need to find out how Rumah Energy can survive without the main donors. So that is the reason for us to try to move our business development wings by PT Pupuk Subur Negeri. um, and considering that for the past 10 years, we have built so many biodigesters, more than 20,000 biodigesters across Indonesia, in which most of the bioslurry is remain underutilized by the farmers. So this is the potential that Rumah Energy try to take. So rather than the farmers that should use them, or maybe to market the bioslurry to other customers. So Rumah Energy take this role. We establish a company to collect every bioslurry from every biogas users. So and then we we package the bioslurry and distribute it to retail markets across Indonesia. I think, yeah, that is the progress of the development. So,
Again, very inspiring. We have like a lot of interaction in the group chat from participants from Indonesia. We have one question from Sri. Would you mind unmuting yourself and asking your question directly?
okay. Yeah.
Or I can just
Thank you so much.
here you go.
Okay, thank you so much, Rumera. Hello, Jihan. I'm Sri from Indonesia. I wanna ask you about, as we know that Indonesia has many islands and absolutely has different problems at every islands. So how you get Rumah Energy can control this project, for example, build program and etc.
Yeah.
programs. Thank you.
Okay. Yeah, very good question because this is actually very challenging in Indonesia. From the cattle husbandry itself, with many islands have a very different characteristics. Like I was initially placed in Sulawesi, in which people mostly let their cattle roams across their fields without any proper shedding of the cattle, in which it will cause challenges in collecting the cow dung for feeding the biogas regularly, because every biogas digester should be fed using the cow dung regularly. It is challenges mostly in east of Indonesia. While in Java, uh, almost every people already know that cattle should be shedded properly. They have cattle shedding for like maybe 5 up to 10 cattle, 10 heads of cattle. So in Java, the challenges is not very difficult for the sustainability. In East Indonesia, it is more challenging. So before the construction, we would do assessment of the prospective biogas users. Uh, we do the pre-construction assessment. We check how many cattle they have and how are the cattle ownership, the shedding. Do they have proper shedding of the cattle or not? Because it is uh, have significant impact to the stability of the biogas. Because if they don't have proper shedding of the cattle, usually the life expectancy of the biogas maybe around 1 or 2 years, and after that they have no interest in using biogas because they maybe they think that collecting the cattle dung from their field is exhausting. So that's why we should carefully assess the shed ownership of the cattle owners. And in the beginning of the projects, we put provincial offices. We have provincial offices in every major provinces. So in every provincial offices, we have a technical staff to monitor the proper choice of the customers, the biogas users, the pre-assessment of the biogas user, as well as the quality inspection that I have mentioned earlier. So Rumah Energi have two roles actually, to ensure in the beginning that our construction partner does not choose the wrong biogas user, and ensure in after the construction that during and after the construction that their construction is according to the standards. So that is our way to minimize every aspect to that reduce to sustainable factors of the biogas, because it is quite different with other programs, like which mostly only construct in the beginning without proper examination of the cattle ownership, and then after the construction is done, they just left without any proper monitoring of the usage of the biogas. I hope that answer your question.
Uh, Thank you. I'm just gonna move into the last two questions for today. The first one from Hyun in Myanmar. Would you like to unmute yourself to ask your question directly? Okay, I'll just ask it for you. He asks, how long does the biodigester last, and is there any regular maintenance that needs to be done?
Okay. So the technical design of our digesters should be able to withstand around 15, at least 15 years, and up to 20 years actually. Uh, but the problem is, it is often the biogas that is not functioning. The problem is not in our biogas, but it's not in the construction, but the users of the biogas. Uh, as we have built more than 26,000 biogas in which we survey annually, we usually samples from every years from the beginning up to the newest constructed biogas. Uh, so we already have that in which already more than 10 years biogas is still operating very well. Actually, the maintenance is not very difficult. They only need to fill it properly according to our standards. Like, you have to mix the cow dung with water in 1:1 ratio. uh, do not mix it with too much water or too less water, because it will create uh, sediment in the digester. So if the problem is, if you have sediment or maybe it cause the failure in the digester, the only option is that you have to remove all the codang inside the digester. And we have to restart the digester from the beginning again. Um, Other than that, because the biogas is actually have it is quite humid. It has a lot of water content in the gas itself. So we already prepared in the system with some water traps along the pipe that connect from the biodigester to the stove. The user is actually just need to remove the waters from the water tap, maybe for around once or twice a year. So uh, with proper feeding every day, the problem is, it can actually very minimize. Maybe you only need to restart the digester for every 10 or 10 years. But if the users is feeding the biogas improperly, like too much water or too less water, it is often that you need to restart the digester every 1 or 2 years. So it is very dependent on how the customers or how the users using the digester, and that is the way that we make sure that our every hour users feel feeding the digester properly. So the first and the second maintenance that I have mentioned earlier is actually to try to evaluate whether their feeding is already according to our standards or not. So because in those in this first and second year, which usually the problems in digesters is already started to rise, like the water in the water trap start clogging the pipes, and like maybe the gas production is lower than the initial feeding, because it is usually found by from the mishandling of the users. Okay, I hope that answers your question.
That is very interesting method. It seems like as long as the user is following the instructions that you have set out for them, everything should be well. Moving to on our last question from Andy in the Philippines. Andy, would you like to unmute yourself and ask the question directly?
Sure. I hope you can hear me well. Hello.
Yes, we can hear you.
Very good. Yeah.
Thank you, Samira. Hi, Jihan. It's very interesting and very good initiatives that you are doing. Perhaps some of my questions. have been answered already, but I'm really curious, how do you ensure communities that you partner with sustain the initiatives that you have started? You have talked a lot about, the standards that you have, but even you shared earlier also about, you know, uh, partners as well. But apart from these, are there opportunities that communities own these initiatives, and do they scale up also? And how do local governments participate or support these initiatives? Because you mentioned only, I think, NGOs like HIVOS supporting your project, right? But what is the role of local governments? Thank you.
Okay. Very good question. I think for the first question regarding the how the community sustain the initiatives, we actually have to make sure every biogas user or the prospective biogas user to understand in the beginning what is the benefit of the biogas and the derivatives. It is, I would say that the benefit of the biogas is 30%. That is what I always says to our biogas user in the beginning. While the 70% of the benefit is actually from the bioslurry because it reduce their expenses on buying inorganic fertilizers. They can have they will have increase in the crop yield like 10 to 30% according to the type of the crop they will they use they have, and how they can turn the bioslurry into their own businesses. And we found that actually several of our biogas users quite creative, and this kind of stories that we try to spread across all of our among our biogas users. So we don't cut our communication after the construction. We remain maintain the communication between biogas users with us, with our construction partners, because our main goal in here is not to build the not to build the infrastructure. We try to build the human. So the most important aspect is the user itself. We make sure that every farmers that uses biogas should understand the benefit of biogas and the bioslurry, and mainly the bioslurry, with those benefits that I have mentioned earlier. And the ownership of the biogas itself is actually belongs to the communities directly after the construction, despite the funding can came from every institution from foreign donors like HIFOS, or maybe but we also have cooperation with local governments. We have signed some memorandum of understanding with several provinces government to fund the construction of the biogas, in which, like I mentioned earlier, like we have 3 million rupiah as subsidy from our carbon selling, and the rest of the cost of the construction usually shared among the government and the biogas user. So we have three-party cooperation. The user usually provide in-kind contribution, like they provide the manpower, they provide the uh, several parts of the material to be used for the construction, because we try to make sure that we use all of the local material available in that place. And then 30% of the construction cost is given to other partners like the local governments. So that is our way to try to uh, reduce the cost of construction, because 10 millions for Indonesian for farmers in Indonesia is actually still considered as very expensive for them. So our partnership with governments is try to provide subsidy. In basically, we try to provide subsidy with our carbon funding and the funding from the government itself. And we actually in every year we should report our progress, our achievement in construction to the government. So to the Ministry of Energy and Mineral Resources, we always report how many biogas that we have built this year and for the past 10 years, and how much biogas digesters that we expect to be built in the following years. I hope that
Thank you
explains
so
your.
much.
Yeah.
Thank you so much, Jihan. Andy, I hope that answers your question. And with that, we come to an end of our session. Thank you so much for joining us, Pats and Jihan, and walking us through how renewable energy and healthcare without harm is raising awareness and contributing to massive efforts in mitigating climate change through sustainability. Uh, I would like to invite both the speakers and our participants if you would like to stay back and gather town and just like hang out, talk more about these efforts on a one-to-one basis. And with that, I will pass to Gurpreet to give us the closing announcements.
Okay, thank you very much, Samira. Thank you very much, participants, and I'm really sorry for running past time today, right? Big shout out to our speakers. Absolutely amazing sharing. So, as usual, I've got a few short updates for you. Today is a little bit more interesting. You guys see my screen, right? We have uh, awards going out. Are you guys ready for the final award session of YCD Summit 2022? End of week three. We have the first top three who never skipped a class: Win Min Oo, Chuck Chuan Eng, and Chan Mia Kin. Guys, what you've done has not gone unnoticed. You have a 1 month Audible gift card subscription coming your way. Thank you so much for attending every single session. That is amazing. Well done. And big respect and shout out to y'all. We have the top three Eco Challenge warriors for the week. This week, our winners are the most consistent Faja, who always uses the public transportation for 2 years in Stockholm. I wonder if it's going to be as easy, Faja, when you're back in this part of the world, right? 95 hours logged just in 1 month alone. Well done. Thank you so much, Faja. Number two, the most creative, Katakun, who decided to convince his friends not to rent motorbikes and use a tuk-tuk instead. Look, it's much more social and fun as well. Thank you so much, Katakun. You also get a prize this week. And lastly, we have Rennie, uh, who has been doing this for years, right? Like she's reduced the most emissions for not using single-use plastic at all. Wow, well done, Rennie. Thank you so much. I wish we had more time because I would love to hear this story, but unfortunately, I got to push on through, right? So, what's next? Next week, Tuesday, there's a pitching competition, right? So just mind you guys that it's not happening at 7:30 p.m. It's 7 o'clock. So please be mindful about the time difference, right? So half an hour earlier because we're going to need 2 hours to go through all the pitches. The timing is going to be critical. Come by 6:45 p.m. GMT plus 8. Please remember that, yeah. Pitching, and on Thursday, of course, is our final closing ceremony, guys. 2022 YCL Summit. The speeches and announcements and small grant winners will happen on Thursday. So see you guys there. All right. Thank you very much. That's it for me. Have a great day and see you guys soon. Bye.
Bye, everyone. Thank you,
Bye. Thank
everyone.
you, everyone.
Thanks for joining, guys. See you next week.